One of the biggest challenges that we've had in our Go Live is actually with the phases of care, as well as transfer of patients and discharge of patients. What we found is that when you put in discharge orders, transfer orders, if an order is put in after you put in those transfer orders or discharge orders, and it's not put in through that navigator, the transfer navigator or the discharge navigator, it will cause those orders to not be able to be released by a nurse. So you'll be getting a phone call, a nurse saying, hey, I don't have orders, or hey, I can't release orders, and you may be in another case, or you may be home for the day, or you may be at a doctor's appointment, and that can lead to a delay in care and significant headache. So always make sure that you're going back in through the transfer navigator or the discharge navigator after the patient has been transferred, so you don't have that struggle. So one big key in transferring a patient anywhere in Epic, it is a bit of a more it's a bit of a more formalized process than it was in Allscripts, but that is a good thing. It can lead to a few hiccups, but it's definitely a good thing, as in there's not confusion in the MAR when it comes to what medications a person is on in the PACU versus on the floor versus in pre-op. You have to reconcile meds when we're transferring from kind of any unit to a different unit, or any phase of care from one phase of care to another. I would recommend doing that immediately kind of after a case, rather than sitting down and just dictating an op note or putting in your standard op note. I would do that first. So when the patient's then moved over, the nurse can immediately release medications and get this patient the medications they need immediately post-operatively. And then you can sit down and do your op note, which you'll likely have a template that makes it very, very easy for you to do, and you can then customize it to that specific case.